COVID has been an interesting world and dynamic for the last 4 months. And as we all know, here in Arizona, we are definitely seeing an increase in cases, in positive cases, as well as you know, having to deal with all of those positive cases in our area and around the country. So part of that was why we wanted to kind of review and kind of go back to some of the basics and some of the things that we've talked about, as well as kind of diving in a little deeper on some of this stuff. So we want to look at the first slide. So back in May, we've been open for business here in Arizona for 2 months. We opened in the middle of May, and our governor here in his executive order told us as we were opening that we needed to look at all of these policies and processes and make sure that as we are opening that we look at all of these things, you know, promoting the healthy hygiene practices, intensifying our cleaning and disinfection and ventilation practices in our offices and our facilities, you know, monitoring our employees for their sickness, ensuring the physical distancing in our offices, providing the necessary PPE equipment that we have, you know, allowing for and encouraging telework whenever we can, you know, providing plans where possible to return to work in phases, and then limiting the congregation of groups of no more than 10 persons when feasible, and in relation to the size of the location. The latest orders and the latest things have kind of said less than 50, but still trying to keep, you know, the limit how many people are in one space at one time, with the increase in cases. We've seen that he's dialing back a little bit on stuff. You know, restaurants are supposed to be now less than 50%. You know, gyms are closed, movie theaters, you know, events are still not able to happen. So we're still in kind of this pattern where as organizations, we need to really think about all of this, and all of these things apply very much in today's environment, and making sure that we are staying kind of on top of it and reviewing the return to work guidelines that we put in place, you know, for June 1st, or looking at our businesses in the middle of May, and what do we need to do. So next slide. And so as we drilled down into those 8 areas, it really, a lot of it fell into these 2 return to work considerations: our recall procedures and how were we going to bring employees back, if we were going to bring employees back, if we were going to allow employees to continue to work from home, what did that look like, you know, and making sure that we are communicating with our staff on a regular and continuous basis on what's happening as an organization as we continue to manage through all of this uncertainty of cases and what to do. And then tied to that is the workplace safety piece of it, you know, making sure that we're continuing to do our temperature or wellness checks with our employees, physical distancing employees, providing those PPEs, the masks for people to wear, since it's mandated in most locations here in the state of Arizona, that cleaning and sanitation procedures are happening, that we're trying not to do travel unless we absolutely necessarily have to as a company. But the big one there is that action plan, and what do we do if we have a COVID-19 illness or an exposure to in our location and with our staff. So that's going to be the piece that we're going to drill down into a little bit more today. Next slide. So in our COVID-19 action plan, there's several things that we need to do. We should probably have, or we should have, not probably, but we should have an action plan team, or at least or a coordinator. So who in your group, which supervisors, which employees, Are you going to pull together to help make sure that we are doing everything we can, that we're listening to our employees and their concerns during this process, making sure that we have this figured out. And if we don't have an action plan yet, this is the time that we need to make sure that we've got one written. So this is a great time for this. Leave policies, going through our leave policies and making sure that we are being flexible with our employees, that we're not non-punitive, that we're allowing our employees to use the time that they have available, allowing that telework, staggering our shifts, really detailing how we're going to manage this on a day-to-day basis. We also need to make sure that we have a business continuity plan tied to this, not just for COVID. You should probably have already had one, but if you don't, this is a great time to create one. But what will you do if you have to shut down again? If we get told that we're in a shelter in place, what is the plans for that? Or what if you have a large group of employees that all end up with COVID-19? How are you going to manage with the shortage of employees, and what are we going to do to get through all of that? And how are we going to communicate this to our employees? So establishing that emergency communication plan. If we end up with several positive cases and we have to shut down our facility, how are we going to let employees know that that's happening? Or, is there a phone tree process in place? Do we have email and letter templates created so that when it happens, we can immediately communicate this information to our employees and to our customers and to our vendors, depending on what it is that's going on, and making sure that we're communicating this information and having it readily available to those that we need. I know we've said this several times, but it's all about communicate, communicate, communicate. And in that communication, it's not just about us communicating to our employees, our customers, our vendors, but it's also listening to those around us and what is going on in their world, and listening to their concerns or what's happening, so that we can make sure that we're touching base and taking care of everybody in the right way. So a big piece of these action plans is going to be about the guidelines around positive COVID cases. So the first one we're going to look at is the exposure to a positive COVID case. So close contact, based on the CDC guidelines, is contact within 6 feet. So under that 6 feet window for a prolonged period of time, which they're stating is more than 15 minutes. So if you're in the same house with somebody, or if you are working in the same cubicle space with somebody, and there isn't a 6 feet window, space between you, that's where this exposure can happen. So if an employee is potentially exposed and they have symptoms, they should self-isolate and follow the CDC recommendations of what to do if they have symptoms, which we'll go over in a minute. If a potentially exposed employee does not have symptoms, they should remain home and practice that social distancing for 14 days. If an exposure is at home and the employee is caring for a sick or positive person, the employee should remain home for 14 days after the positive case person meets the criteria to end home isolation. So, and then all other employees, so if they didn't have a close contact, but there may be a secondary exposure, then all those employees should self-monitor for symptoms, continue to wear their face masks in public, and then if symptoms develop, they need to notify their supervisor or that action plan coordinator and stay home and follow then the guidelines of the CDC. So we want to make sure that employees know these steps and know who they need to contact and what they should be doing. So we need, as employers, to make sure that we are communicating not only our leave policies, our action plan, but include this in our action plans and communicate this out to them as well. Now, what if your employee is the one that is the positive COVID person, which is our next slide.
Sorry, I'm here. I was just trying to process that information.
It's a lot. It's a lot.
So, okay, so let's say that somebody in my household has it, which means that they were probably, so they're going to be fighting it, so that could potentially be a week, right? 10 days.
Right.
When they're no longer symptom-free. So then we have another 72 hours on top of that. And so then the 14 days in that third bullet point clicks after that 72 hours. So,
correct.
I mean, we're looking at almost 3 weeks.
Potentially.
Minimum time if somebody has exposure at the home.
Yes.
Okay.
And we need to make sure that we are being non-punitive and thoughtful to our employees about this. You know, that it could be, you know, that's where we need to really look at our leave policies and where are we, you know, using our FFCRA, which is 10 days, but an employee could potentially be out longer than that. So is there other options? And we'll talk about this a little more deeply in some of the other slides of, you know, when can an employee come to work and what does that look like? So now you've got a positive, you've got an employee that has called you and said, I have all the symptoms, or I have a confirmed positive. I went and got tested and I've got a positive, I tested positive. When you get that confirmation, you should close off any areas that in that office, or maybe you have to close down a facility that was used for those prolonged period of times by that sick employee. So if it was for longer than 15 minutes, then that space needs to be kind of locked down. And you're going to want to wait for at least 24 hours before you go in and clean it, because you want to minimize the exposure to your other employees or your cleaning crew before they go in and start disinfecting everything. Per the CDC guidelines, if it has been more than 7 days since that sick person was in an office, so they came in, they were sick, you sent them home, it's taking up to 12 days to get a test result right now. If it's been 7 days since they were in that facility, then we don't have to do initial cleaning because you've been cleaning, hopefully, on a regular, consistent basis since that's happened. But we do need to inform our fellow employees of their possible exposure. If they've had that less than 6 feet contact and a prolonged more than 15 minutes, we need to notify those employees of their possible exposures, but maintain the confidentiality. You can't say, oh, Jill has a positive test result, so you need to now quarantine for 14 days. Don't use names, don't, make it as generic as possible and maintain the confidentiality of our employees in this process. But those employees now need to self-isolate or be able to telework if you can allow them to telework for those 14 days while they wait to see if they end up with symptoms or not. And employees who test positive must remain under quarantine until they meet the CDC guidelines for returning to work. So we want to make sure that we are being thoughtful and in the process of this. And again, making sure that our employees know that they have leave available to them and using that leave during this time. So it may be that they have their FFCRA, then they can use their Arizona sick time. If they have PTO, they can use that. If someone is sick and isn't got an extended time, they may be in the hospital, then maybe short-term disability would kick in if you have short-term disability coverages. FMLA protections would kick in if you are over 50 employees. So we have to look at all of that stuff. This is a time where we, as we talked a couple of weeks ago, of showing our employees we care, and how do we do that while we still continue to try to run the business. And we know that running the business is going to be hard if we're shorthanded, but that's where that business continuity plan comes into play. And how are we managing those processes with our employees? If we have a mass spread, say you've got a handful, 3 or more employees, 5 or more employees that are calling in, they've all tested positive, you've got a mass spread in your office, then we need to call our local health departments on guidance from them on bringing in somebody in for employee testing. How are we going to do the contact tracing process? How are we going to let our customers or vendors know if they've been in the facility and we've got a mass spread of that? What kind of message assistance can they provide us? Guidance for how long does a business maybe need to close if we have to close because of a mass spread or a mass group of COVID positive employees. So it's using our resources both locally and on the federal level with the CDC, with OSHA, and our local health department, and helping us manage through this process when this happens. Because as they get new data and as they hear about new symptoms, is keeping up on all of that as well. So now what do? An employee says, I want to come back to work. They're leaving the COVID behind at home. The CDC outlines 2 ways to say that someone can come back. The symptom-based strategy is they have to have 3 days, 72 hours have passed since they've recovered, since recovery, which is a resolution of the fever without using any medication, and the improvement in the respiratory symptoms. So no cough, no difficulty in breathing, and at least 10 days have passed since the symptoms first appeared. So that's where that time frame comes into play, and it may be longer than 10 days if that 3 days doesn't hit until our 15th or 20th day. So even though 10 days may have passed of the symptoms, if they're still using medication to feel better, they still can't come to work. It's both things have to hit. The test-based strategy, they have to hit all 3 of these points. They have to have a resolution of the fever without using medication. They have to have improvement of their respiratory symptoms, so no cough, no difficulty breathing, and they have to have 2 negative results from 2 consecutive tests collected at least 24 hours apart. So I can go get a test on Tuesday, then I have to go wait and go get another test on Wednesday, and both of those have to come back negative before I'm allowed back in the office. And test results, again, are taking up to 10 to 12 days right now here in Arizona to get the results. But that's another way, that's how they're determining in hospitals when patients are starting to be released, is if they have negative results, 2 negative test results, before they will release patients from hospitals.
And so Diana, these are,
yep.
What's the word I'm looking for? I always use the wrong one. It's not the one where you cut your nose off, it's the one where you stick the swab in the nose. Nasalectomy?
Yes,
nope,
yes.
That's the wrong one.
You're not cutting your nose off. Yes, these are the nasal swabs. This isn't an antibody testing. This isn't, this is either the nasal swab, or they are starting to do saliva testing. And they're seeing that those are coming back a little faster than the nasal swab tests are. But yeah, this is the Q-tip up the nose to your brain tests.
I don't think it actually goes to the brain, but I'll I'll leave it at that.
It feels like it.
we have some medical folks on the phone. We could probably unmute them. And okay. And then we got another question, but I think you just answered it, and it's about the return to work strategy. So this is really the outline of the draft.
Correct.
Of what your return to work is going to be. And I know
Yes.
that we've developed a template, so I know we can certainly be assistance if somebody wants to talk through it. But this is effectively, this is your starting point, and then you're kind of working around it for your almost your business continuation, which is another question which came in recently, was, are we working with individuals and companies to create the kind of the business continuation strategy, or is that more industry specific? And I know you mentioned that most organizations already have this, but certainly it has to be reviewed and adapted. But is that something that you and your team or Dennis are assisting with as well?
Yes. Yeah, and we can help with this, but it's definitely individualized to industry, to company size, to the reason why we're having to manage a business and being shorthanded or whatever it might be. It really is specific to the organization and the nuances of that organization. But this gives us guidelines, at least with regards to COVID, of how we have to manage through the process of an employee either being exposed or having COVID, and the guidelines around when they may even be allowed to come back to work, and all of the things that are tied to that. But it's a continuing communication with our employees on what that means. Again, it's that whole, communication. It's not just having a communication with your employee the day they call you that says they're sick, and then you don't talk to them for 14 days. It's checking in with them throughout this process and seeing how they're feeling, what's going on. Because if they've been sick for 3 days and then they're feeling better and they're not having to use their symptoms are getting better, then that 3-day clock starts, and then that 10 days from the first time they got sick, so they can come back sooner. So it's really keeping in continual contact with your employees on what's happening with them during this process, and not just waiting 10 days before you reach out.
And so the symptom-based strategy and the test-based strategy, that is an either or. And the reason
Yes.
for my question is because we had a question that came in specific. It says, how does an employee get 2 COVID tests done to prove that they've recovered when they're taking at least 10 days? Because clearly it kind of goes back to my addition statement earlier, is that now we're back out to a 2-week time frame,
Right.
just based upon the lag of again the time. So this is an either or.
Yes, that's the way at least that's the way I understand it from the CDC, that there's these 2 options. I'm going to guess that the symptom-based is, you're working with your doctor. They don't feel that your symptoms are serious enough to warrant a hospital stay, or, that you've got some mild symptoms that you can treat yourself and take care of yourself at home. And so that's where the symptom-based strategy comes into play. I think the test-based strategy is more of where they're in the hospital, they are very sick, and they are getting more regular medical attention, where those test results are probably happening a lot faster in a hospital setting, clearly, than if you're just going down to the next care or the CVS to get your test done.
Okay.
And they're asking, even if, doctor offices and those clinics are asking questions before they're even going to allow someone that's already had a positive test to come back for a positive test. They're going to make you use a separate entrance or come at a different time, so that there isn't a chance for you to expose to another patient. So I think the test strategy is one where you're working very closely with your health provider or are in the hospital and managing with that, versus the symptom-based strategy.
Okay. Thank you.
Yeah. So then I just wanted to kind of remind folks, our top 10 list that we've shown this a couple of times over the last few months, of all the, the top kind of 10 things that we need to think about as employers as we're working through all of these things and setting up our action plans and our return to work plans and all of that stuff that, we should never rush into this process by opening up too quickly. We've decided as, in our company, we thought we were going to be able to start coming into the office, and we changed our minds as we continue to work through this process. So, being flexible and really paying attention to what's happening in the state and in the community around us, to make sure that we are keeping our employees as safe as we can. Again, that whole communicate, not just out to our employees, but listening to our employees and listening to what they have to say and taking into account their issues, their concerns, and helping them where we can, following the guidelines provided to us by the CDC, by OSHA, by the DOL, by our state and local authorities, by the state and local health departments, and using those resources to map out what we're doing and keeping up to date with those, because they do change and they are changing as we get more information about COVID and all of those things. Again, finding out what matters to our employees, listening to their concerns. How can we keep them engaged during all of this process? Allowing our employees to continue to telework and telecommute whenever possible. Again, it's this
And
is
then,
that.
Oh, I'm sorry. I was thinking out loud, and
Yep.
Because I know we're talking, like for us specifically, we'd have the benefit of being able to continue to telecommute and work from home. But we have clients, and I know there's lots of organizations that, they are open, and they're seeing clients, and they also have employees coming in, and so I think the summary is that the recommendation is that make sure that if you do have employees coming in, that you're following these guidelines with the 6 feet, staggered shifts, cleaning protocols, et cetera. But is there any activity that's happening already as far as from an employer's perspective, from like legal cases? Is there anything that's happening for employers are getting pushback and there's lawsuits, or is there any type of legal proceedings that are happening because of their going back to work?
Definitely. I just was reading an article. Fisher Phillips, that law firm, has been tracking the cases and kind of watching what's happening in the lawsuit world. And most recently, they've tracked that they've seen 283 cases have been filed. 43% of those were filed in June alone. So we're seeing definitely a growth and an uptick of cases. And the case breakdown of these discrimination, there were, out of that 283, 63 of those cases were discrimination cases. 62 of those cases were work from home or leave claim cases. 41 of those cases were retaliation. So retaliation meaning they asked for leave, were told no, and then were fired. Probably similar cases like that. 26 cases were unsafe working conditions and PPE cases. So you didn't provide me with PPEs, you didn't keep me safe because you opened and everyone got sick. And then 21 of these cases were wage and hour claims. You're not paying me when I'm working at home, or you're not paying me my overtime when I'm working from home. I'm working more hours at home than I was at the office. What's interesting with this as well is that 41 of those cases are class action suits. So it's not just a one-off, it's a group of employees are now suing their employers, and those are mainly focused on the unsafe conditions and wage and hour claims. We're also seeing families are starting to file claims against employers because one of their loved ones died while working, or they're saying because they worked at a facility, essential workers. So, you know, Fry's and the Walmarts and and those organizations are starting to get suits against them for death claims. So yeah, it's.
Are you getting it?
Employers.
Are you seeing or are you reading anything on just like how they're? Is there any resolution to any of these? I guess.
Not yet.
So let me. Okay,
It's
I
new
figured
enough
that
in
was just way
the
too soon.
system that they haven't necessarily made it all the way to the court system yet, but we're seeing the filings happen, and so we still have to take that into consideration that they're happening.
And this might be a question for Dennis too, and I don't know if he's on the line, but we can also do a follow-up for this. So if I'm an employer, which clearly I am too, as well as pretty much everybody on the phone right now, and I'm following the CDC guidelines, I'm following the health department guidelines, you know, and I've got my return to work, got my business continuation. I mean, are these things that are helping insulate me as an employer so that if a lawsuit, because it sounds like it's a buckshot approach, and I'm trying not to be crass, I'm just trying to kind of think through it logically, where they're kind of just, they're suing. Is this a defensible position to say, I'm following everything that the agencies are telling me to do? And I just don't know if you have any data on that, or is this something that maybe is more for a Dennis question?
Yeah, I don't have specific data to it, but where my brain goes with it is if we have written policies in place and we are following those written policies, and that we are showing as employers that we are not willfully neglecting our duties as employers, I think we are in a better position than we would be otherwise. So it's,
right.
You know, I think that if employers are trying to do the right thing and we are communicating that to our employees and are, as number 10 in this says, that we're being human and that we show that we are all in this together, that we're going to try to do everything we can to keep our employees safe and healthy when they are in the office. And if they have to be in the office, that we're going to do everything we can to keep them safe and healthy during this time, then I think that helps with these lawsuits. I don't know that it stops them, but at least it helps.
No, I don't, yeah, I don't think it's going to stop them.
Right.
But that's where I was just kind of, it's just more of a P&P procedure, because you have to be able to say, you know, insulate yourself to say, I was following everything that I was told to follow. And clearly it changes because it's a growing,
right,
you know, there's source of information that keep on growing. But I think if we're using that as kind of the baseline, at least it's a good start.
And we're also showing that while we're following these guidelines, if we find that we've got 3 or 4 or 5 employees that have called out sick, that we are now also reaching out to our local help, to our health departments, to our, you know, whatever guidance, you know, reaching out to the CDC, reaching out to our local OSHA office, reaching out to the local health department and saying, okay, this is what's happening. What can I do now? You know, what should I be doing? How do I make sure that this stops? What do I need to do? So reaching out to those resources as well to make sure that we're doing everything that we need to do to keep people safe.
Okay. Boy, I don't know how I'm going to follow this. I'm just talking about Cobra.
And it's training, you know, it's training and educating our supervisors and our managers on how to respond to, say, you know, an employee calls in sick, or they call in and I'm really worried, I don't want to come in, I am immune compromised and I am worried and nervous about coming in. Educating and training your managers on how to respond to those, but that's also where having that action plan committee or coordinator is important, because then those supervisors can then say, I'm going to put you in contact with Julie and she's going to help you navigate the process. She has the steps, she has contacts for testing, you know, so that the employee doesn't necessarily have to do the research themselves. We are helping them and providing them with that, with those tools. Because again, it's being human and showing them that we're all together, and how can we show our employees that we care about them and that we're going to do whatever we can to help them during this process.
Right.